Joining us now is Jeff Schlegelmilch. He's director of the National Center for Disaster Preparedness at Columbia University's Earth Institute, where he focuses on public health preparedness. Jeff, thanks so much for being with us. First, I want to talk about some of these players in the race for a vaccine. Talk a little bit, if you can, about some of the front runners.
Yeah, so some of the vaccines that have had some really positive data coming out, particularly the Pfizer-led initiative as well as the Moderna vaccine. Pfizer's already put in its paperwork for the emergency use authorization with the Food and Drug Administration in the U.S. And so right out of the gate, we're seeing high levels of efficacy, frankly, a bit higher than we were expecting, which is very, very good news. These use the messenger RNA technique for the vaccine. The downside is it is a bit more complicated in terms of the logistical chain. It has to be kept at very, very cold temperatures, especially the Pfizer version of the vaccine. And it looks like it's going to have to be 2 doses several weeks apart. But it is very promising, and with many more in the pipeline, among many other companies using different methods, it should ultimately give us into 2021 a good range of vaccines to be able to work with for different people in different locations.
There are, of course, other vaccines beyond the United States. Donald Trump, though, has taken the U.S. down the road of an American first strategy. In terms of getting a vaccine to Americans as quickly as possible, given the fact that there are others beyond American borders, has that approach had consequences?
Yeah, to date, I mean, there's certainly been some strategic investments made by the United States, but really, I mean, most of these companies that are involved with this are very global in nature as well, too. So I think in terms of that, I'm not sure what the direct consequences in terms of the push and pull with other developers in other countries. It is worth noting that the United States is among the largest, the burden of cases. North Dakota actually had the highest per capita mortality this week of COVID-19 in the world. Regardless of where the vaccine is coming from, there's obviously an urgent need for a variety of reasons in several hotspots around the globe, and in particular the United States.
Rick Bright, the Republican whistleblower who left Donald Trump's coronavirus task force, now serving on Joe Biden's, suggested that there's less credit due to Trump's Operation Warp Speed and more for the Obama administration's investment in messenger RNA technology. Can you explain that? This is what effectively is the element that's leading in the current vaccine frontrunners in the U.S. And also, how much does early planning and investment matter in moments like this?
So early investment and planning is everything in moments like this. So to Dr. Bright's point, and it's also worth noting, the Pfizer vaccine was not part of Operation Warp Speed. But the messenger RNA platform is actually something that had been invested in strategically through BARDA, the authority within the United States sort of investing in strategic vaccines. Really, many, many years before, and certainly before the Trump administration, we've seen it used in candidates for Ebola vaccines as well as others. And so, and of course, they're among the first ones out of the gate. So these sort of strategic investments to build the foundation, to build the science, so that when these sorts of pandemics emerge, we're not starting discovery with a blank sheet of paper, is one of the most important strategic investments. And we see it that it's saving time now and will probably ultimately save lives.
Aside from the obvious preparations that you mentioned, you've argued that COVID-19 has seismically shifted the food supply chain. How so, and what will it take to get it back into sync?
Yeah, it's really exposed across a lot of our supply chains, the fragility in them. I think particularly in the United States, but also globally, you know, it's not that there isn't enough food, it's that people can't access it. So whether it's, again, in the U.S., a lot of this is income insecurity. People can't afford to go to the store and buy it from loss of work and other reasons. So we're seeing food pantries, locations where people collect free food with extraordinarily long lines. Globally, we're seeing this with challenges with migrant workers being able to get into harvest crops in Europe and other parts of the world, as well as with lockdown orders, with export restrictions due to hoarding behavior, people buying up a lot, actually leaving countries where, you know, if there's less grain on the market and it goes to the highest bidder, that highest bidder is probably not going to be a very poor country in sub-Saharan Africa when it has to compete with other countries like that are much wealthier.
Jeff Schlegelmilch, lots to think about from Columbia University. Thank you.
Thank you. Thanks for having me.